If you know you don't like calamine spray, don't get close to it because it's going to actually trigger you. You will start vomiting. I'm Midwife Angela Sokwenu, a staff here at Suncity Medical Center. Today we are going to be discussing the topic morning sickness. What is morning sickness? So morning sickness normally occurs during pregnancy, at the initial stages of pregnancy or during the first trimester of pregnancy. Based on the triggers you have during the day, it makes you feel like vomiting. This morning sickness or this nausea and vomiting doesn't only occur during the morning. Sometimes based on the triggers, which are the smells that you encounter during the day, someone might throw up in the afternoon, in the evening, at midnight, at any time, but most of the times first thing in the morning. So someone might ask, what are the causes of this morning sickness or nausea and vomiting? The presence of the progesterone and the estrogen. Normally as a woman, we have these hormones that actually help in our daily activities or in our cycle. Let me say it that way. As a woman, we go through these cycles and where every month you have your menses, and these two, progesterone and estrogen, actually plays a role in this. But then when you get pregnant, there is an increase or a surge in the progesterone and the estrogen, and this can cause excessive vomiting initially. Another cause of the morning sickness is the HCG hormone, which is known as the placenta hormone. So from the beginning of the pregnancy, when the pregnancy starts to develop at a certain point, the placenta begins to release hormones known as the HCG. This is the hormone that when you take a test kit and you take a test in your house with your urine, you realize that this is the hormone that actually speaks. And during pregnancy, getting to the second trimester of pregnancy, it increases in the blood, and then it also causes excessive vomiting. The third one is the increased sense of smell. Some women tend to have more sensitivity to smell. When she wasn't pregnant, she lives her normal life. In fact, something smells, she doesn't sense it, she doesn't even know. But when she gets pregnant, she begins to become more sensitive. Every tiny smell, she takes note of it. First symptom I would say is loss of appetite, the feeling of nauseation. Then some women also have depression because they are not able to go through their day-to-day activities properly. They become depressed. It's like, I don't know what is happening to me. Then some women also have general body weaknesses and they are always feeling dizzy. One way of preventing morning sickness is avoiding the triggers. If you know you don't like a particular smell, for instance, there's a spray called calamine. If you know you don't like calamine spray, don't get close to it. If you know you don't like the smell of jollof, don't get close to it because it's going to actually trigger you. You will start vomiting and you are trying to avoid it. Don't eat till you are full. Don't be too satisfied. When you go back to your old self, you can, let me say you like fufu. So your bowl of fufu, you like it very hot, classy, I mean with the meat and everything. Then you eat to your full, then getting up is a problem. But note, now you are pregnant, you have morning sickness. You don't eat till you are too satisfied. You eat small. Then the next point is what? Eat in bits. Eat small, leave it down, cover it down. Come back 1 hour, 2 hours time, eat again. This will actually help to reduce the feeling or the urge for vomiting. Another way of also reducing the symptoms is always having dry crackers around, like the soda cracker, the King's crackers and those things. This actually helps to what? Prevent or reduce the urge of vomiting. Then I also say you reduce the eating of spicy foods because you tend to have heartburns, which actually causes the urge to vomit. So you reduce your pepper intake, the spices that actually don't go well with you, you reduce them or even stop them. Immediately after eating, don't lie down. After eating, walk around, do your normal exercises before you come and lie down so that the food doesn't come up again for you to throw up. So now we are going to some of the remedies for morning sickness, which are the natural remedies. My first point is the ginger tea. You can also carry peppermint oil around. Then we also have lemon, the peel of the lemon or even orange. That one too, you bring the peel close to your nose just to help reduce the urge to vomit. So based on what we've discussed today about morning sickness, if you don't have a certain understanding and you want to ask any question,
you can post all your questions, relevant questions, on our social media handles, and we will make sure to answer them for you. Thank you.